Hey, you made it to our live Winning Wednesday. We're going to be talking about advocacy and nursing. If it's your first time joining us, hi there. My name is Regina Callion, and I am so happy to be your NCLEX instructor. My number one goal is to help you get your nursing license by passing NCLEX. So we have a very important subject today. We're going to get right into it. This is Winning Wednesday. You made it live. Advocacy. Oh, so important. When you think about an advocate is the process or a person who is supporting somebody else or some other thing. This is super important in nursing because this is what we do. We speak for our patients. We argue for them. We support them. And sometimes it's a patient, sometimes it's the family, sometimes it's a group of people, right? And so we see this in nursing, and this is why we have to make sure that you're clear on advocacy before you take your board exams. And so I think we have the idea down, but how does it relate, right? And when you think about what nurses do, we get our scope of practice from the American Nurses Association. And so if we read what they have to say about it, advocacy is considered a part of your daily practice. The ANA believes that advocacy is actually a pillar of nurses. It is something that we instinctively do. We instinctively advocate for our patients in their workplaces and in their communities as well. I love knowing our code of ethics because our code of ethics also guides what it is we are expected to do on the job. And so the nurse is there to promote, right? Advocate for the patient and also protect the rights, health, and safety of the patient. This is what we do, right? This is what we are expected to do. So we're going to talk a little bit more about it. We're going to talk about, the nurse's role as the client advocate. But I wanted to tell you that I have a great community resource coming up. I am teaching a class. It is actually a free online class, and it will be specifically pertaining to test-taking anxiety. So if that is something that you want to explore, learn how to overcome, finally stop letting it affect you, I will be doing the class very soon, actually next week, April 25th and 26th. Now, I need you to sign up for it by going to my website, remarnurse.com/anxiety. And this, again, is a class that I will be teaching all about test-taking anxiety. I am not going to send you into the NCLEX unprepared. The idea is that if you address test-taking anxiety, then you will be able to work through it while you are taking your NCLEX exam. Because it doesn't matter how much you have studied, if you let anxiety take control, your performance will probably go down. And so we want to avoid all unknowns when it comes to taking this exam. I want you to be prepared. So again, the anxiety workshop is coming. It's coming soon. Go to remarnurse.com/anxiety. And to recognize the anxiety workshop, I have a coupon code for my NCLEX virtual trainer. If you guys are ready to start the full program with me, I'll talk a little bit more about it, but our coupon code is no stress, and it is going to give you an amazing discount on the NCLEX VT. Again, that coupon code is no stress. Check it out at remarnurse.com. So we were talking about getting back into it, the nurse's role as a client advocate, the nurse's role as a client advocate. And, honestly, there are many, but what are we doing? First of all, this is a big one. If you're watching the news, if you are watching what is happening to nurses, we have to make sure that we are protecting, we are upholding client safety. Guys, that is huge. We need to ensure that the client is safe, be it when treated within the healthcare facility or when they are discharged in the community. So education is what we have to use to maintain safety for the patient. Nurses as client advocates also give clients a voice. And so when our clients are vulnerable, then we are there to assist them. And we do that by asking questions, getting answers, and also making things simple for the patients to understand. So we are translating the information from the medical jargon that the doctors give, right? And when we fail to do that, we are putting our patient in danger. What else do we do? We also educate. Like I said, nurses can make a difference by educating clients on how to manage their current health condition and also improve the quality of their everyday life. And so these things, patient safety, speaking for the patient, advocating for them, educating them, these are all really great NCLEX questions. Also, we protect the client's rights. And so as well as knowing about advocacy, you have to know about your client's rights. You have to know about their right to confidentiality. You have to know about, their right to correct medical information. And not only do you have to know that the patient should have access to those things, but you yourself as the nurse, also, you have to give the patient that information. You have to give it to them. If you are talking about a diagnosis or a medication, it is the patient's right to know what it is you're administering. And if it's not your specific duty to inform the patient, you have to be able to direct that patient to the right person. So parts of the process that you have to be aware of. Also, reviewing for errors. Oh my goodness, guys. Nurses are getting jail time. Nurses are getting their license revoked because they are not protecting their patient from known errors. So by conducting reviews, nurses can spot errors that may negatively affect the client. So the right medication, the right time, the things we learn in Fundamentals 101, those are things that protect people from errors. And connecting the clients to resources, very, very important for the nurse to do. We are supposed to help clients find resources, whether it's financial assistance, transportation, support networks, inside or outside the hospital to support their well-being. And now we have to be careful because it is not to say that the staff nurse is also going to be responsible for social work tasks. That's not the idea. But there are nurses who function in a supportive role, right? And a resource nurse, an advocate nurse. And so this is what they are positioned to do. But as a general staff nurse, you have to know what resources are actually going to be available to your client when they're in your healthcare facility. That is your responsibility to know and to speak pretty intelligently about. So another important thing that we should take note of, guys, is this, and I'm not going to keep you long, but the chain of command, activating the chain of command as your client's advocate. And so this is the instance if a situation is bigger than what the nurse can handle on her own. It's out of her scope of practice. Some new information has been introduced. The patient needs more assistance. And so what does that look like when we're talking about activating a chain of command? What are the reasons that we would do that? And so again, it is there needs to be more communication. Something has happened and we have to make others aware of it. Okay, your client's care has been insufficient, or they need more, right? Or maybe there is concerns with actually the provider, and it could be the doctor, but it also could be the nurse, or it could be the therapist, or it could be dietary. For some reason, we are going to have to invoke the powers of the next higher level up person. And so for NCLEX, you should know that looks like this. All right. And this is an example of a chain of command. So you have your staff nurse, right? And your staff nurse is the one that's going to be working with your licensed practical nurse or your nurse's unlicensed assistive personnel, right? And then from there, typically there is a charge nurse in place. But at the same time, if there's not a charge nurse, then there is this nurse supervisor, depending on where you work. Every unit may not have a charge nurse, but there should be a nursing supervisor over a particular unit or a particular wing of a hospital or a particular facility. There is a nursing supervisor, and then the nursing supervisor would ideally speak to the healthcare provider or the physician directly for that situation. Okay, for that situation. So very important. Very important. The resources that you can study further on, the references that I use are all listed here. Take a screenshot of it, and you will be able to get some really great information about nurse advocacy. But I hope that I summarized it pretty well for you all. We have the NCLEX anxiety workshop coming up. And I also want to spotlight the virtual trainer in a second here. And I do have some practice questions that I want to go over with you all on advocacy, but I wanted to have you to write this down because April 25th and 26th, put it on your calendars, is our anxiety workshop. It's a 2-day event where I'm going to go over the different types of anxiety, how you can determine what you have. We're actually going to take a self-assessment of anxiety, and then we are going to talk about it, and it's all free. So sign up for it at remarnurse.com/anxiety. And I also have my NCLEX virtual trainer right now for you guys. This is how I prepare nursing students with my full NCLEX review. It is totally comprehensive, and you can get all of my classes on demand right at your fingertips. And it doesn't matter if you're a registered nurse or a practical nurse. All you got to do is sign up for the program, and you will get instant access to my courses. And there is a lot of them. There is a lot of videos, but I help prepare you by keeping it simple, short, to the point. You're going to love my videos. Here is one that I'm going to give you an example expansion of. To take place. 36 to 42 weeks, a woman is going every week to see the doctor. So there will be weekly doctor's visits. And at 36 weeks, there is rapid fat production in that fetus. Another term I want you to know is called lightening. And lightening is when the fetal head drops down into the pelvis so that the baby can enter into its final birthing position. These are your monthly doctor visits. Let's move on to two very important terms that you want to make sure you know the difference between before taking your NCLEX exam. They are gravity and parity. Yes, know the difference between these two. Gravity, number one, it is the number of pregnancies that a woman has. And so, guys, what I'm trying to show you about the VT is that sometimes you're not able to make it to a live course, and sometimes you're not able to sit in class for 8 hours a day. the virtual trainer that I've prepared for you guys in combination with the books and the videos helps you. It helps you to watch the lectures as if you were in class and take notes. And in addition to the videos, because people always ask, well, Regina, what is the virtual trainer? The virtual trainer is a fully comprehensive program that you're able to do in the comfort of your home. When you sign up for the course, you're going to get 3 months access to my 6-week program. Now, the program is only 6 weeks, but you're going to get 3 months inside of the program. And I'm going to take you back into it here.
So even you're able if that baby was not born,
you're able
so
to
that
get
includes
all of the lecture
any
videos,
abortions.
Okay. And then you're going to have the ability to learn the system, do getting started. While you're waiting for your books to arrive, you can come into the before the books arrive section, or you can jump right into the course. This is the course right here. And again, I have it for registered nurses. And I also, you see here, the one that I have for practical nurses. So make sure you get the one that you need. If you're a registered nurse, you're going to get the first program. If you're a practical nurse, you're going to get the second program. Another thing that you will have is, the Let's Talk NCLEX videos, the Monday motivation. These are all things that are supportive to you. But the course, again, is going to be a system where you're going to hit the important points of the test. So I start with pregnancy, and then we do pediatrics, and then we do age-specific nursing care. And also at the same time, I'm giving you homework to do. I'm giving you quick facts to do. I'm giving you a calendar to do. So even though you have your courses and your videos that you have to complete, what is great about this program is that there is accountability. So for example, if I go to your homework, right? If I click on homework, it's your time to do homework. You are going to have to get a 95% on this 12-question quiz in order to pass, right? I put that accountability. So all of my exams, you're going to have to get a 95% or more in order to pass it. Now, another thing that I'm going to show you about the virtual trainer that you are going to love is that if I go into your file vault, and I know many of you have the virtual trainer, but some of you have never seen it before. If I go into your file vault and then I go to your NCLEX calendar, you are going to be able to pull out, if you're a registered nurse or practical nurse, you're going to be able to pull out your daily study calendar. And it is a file that you will download. And so every time you come to study during the 6-week program, you are going to know exactly what you will be studying. Okay, you're going to know exactly what you're going to be studying. So I have you studying 1, 2, take a rest day, study again. 4, I have you studying 4 days a week with the weekends off. Come on, anybody can do that, right? I make it so easy for you to know exactly what you're studying for today. So for example, this is just sample times. If you start studying at 8 o'clock, I'm going to tell you exactly what to study. Study your quick facts book, pages 11 through 20. And I hope that you guys who have the virtual trainer are using it, are using this calendar because it helps you. And then I have you going to your maternal and child progress exam. I put here literally take a break because it's so important when you're studying for NCLEX to take a break. And then you can continue on studying, and I have you studying here another video and then some pharmacology. And then that's it. That's the end of the study session. So every time you sit down with your NCLEX review, you know exactly what you're going to be doing. A major part of why students get so overwhelmed and why it takes them so long to prepare for NCLEX is because they have no direction. They have a lot of different books. They have a lot of different resources, but they don't know where to end and where to begin. And so the virtual trainer solves that problem for you because you know exactly what you will be doing when you're supposed to be studying. And like I said, this is a 6-week course, but I only have you studying 4 days a week. So how people get through my course in less than 6 weeks is that they will literally take the calendar, and instead of doing, let me make it a little bit bigger. This is week 3. Instead of doing Monday, Tuesday, take a break on Wednesday, they will just do Monday, Tuesday, not take a break, do Thursday's work on Wednesday, do Friday's work on Thursday, and they'll keep going. So, you know, and as you can see, I don't have you studying for more than 3 hours a day. The sessions are reasonable. And I include breaks and things into your sessions. So you can get through this program in less than 6 weeks if you just study the calendar. If you just study the calendar, you will move beautifully through my program. And so even though it may seem like, oh, there's a lot for me to do in the virtual trainer, remember, you're using the calendar and it is telling you exactly what you should be doing. So again, this is the program that is helping a lot of my nurses successfully do things they never thought they would do, which is pass NCLEX. I'm going to put on another short video for you guys, just give you a preview of what you will see when you are taking the NCLEX virtual trainer. Let's just do IV therapy. Let's talk about some IV therapy registered nurses. IV therapy, super popular, super common because it has many uses. IV therapy is used to provide fluids, nutrition, and medications, all things you will find very common in the hospital environment. Now, there are devices that you need to know that are used to give IV route things, such as, number 1, a peripheral catheter, and 2, a central line. Now, when I was a new nurse, I really didn't understand the difference between these two, but I find now that actually they're quite similar. A peripheral catheter is essentially a short catheter that is inserted into a peripheral vein. And when I say peripheral, I mean anywhere that's not in the chest or the abdomen, right? So anywhere that's not in the chest or the abdomen is considered your periphery. A central line is a longer catheter that is inserted centrally in a vein, right, in the body. Now, because it's a central catheter, then you know that vein is in the chest area. So that's the difference, really. The peripheral catheter is going to be shorter and it's going to be on the periphery or outside of the chest area. The central line is located centrally in the chest area. So now you know more than I did when I was a new nurse. Let's talk about peripheral catheters. Peripheral catheter cannulas have sizes. And those sizes are according to numbers. So actually, the smaller the number, the larger the cannula size. Your IV tubing care for NCLEX, we're changing all IV tubing within 72 hours. Okay, so this is according to your hospital. Okay, guys, I'm going to pause the video right here. And I'm going to remind you that, again, everything will have an open access to you once you get the virtual trainer. And you can watch these videos on repeat. I have people that have gone through the course 2 and 3 times. So intravenous therapy is a topic that you will find in your NCLEX RN review. And I hope you will learn all about the different IV fluids and take lots of notes, because one thing about the VT, it is entertaining to watch. Yes, it's entertaining to watch, but it is even better when you're able to take notes with it too. So I actually want to get back into our Winning Wednesday topic, and you guys can ask me questions about the VT later, but I want to get back into our advocacy topic because I did say that I had practice questions and I don't want to forget the practice questions. So here's our first one on the topic of advocacy right here. And it is this. Nurse Anna is caring for a client with an electrolyte imbalance. She understands that the best care the client can receive is when the client works together with which of the following? Is it number 1, family members? Number 2, healthcare provider? Number 3, healthcare administration? Or number 4, medical insurance? What say if you guys go ahead and put the answers on the screen? Is it number 1, 2, 3, or 4? We're talking about a patient and knowing that they receive the best care when they work together with who? When they work together with who? And that answer is going to be, a lot of you got it right. Yeah, a lot of you got it right. It is absolutely going to be number 2, the healthcare provider. Client-centered care is often going to be associated with better health outcomes when the healthcare provider is focusing on what the client needs, and the client is also engaged as an active participant when planning his or her care. There is an opportunity for the client to actually get involved, take control of their treatment process, also known as autonomy. Hey, let's do another question, shall we? It is this. Oh, a nurse is advocating for a client. Which action by the nurse would require follow-up training? Okay. Is it number 1, telling the client the healthcare provider's credentials? Is it number 2, telling the client the best treatment option for them? Is it number 3, telling the client to make use of resource services? Or 4, telling the client to take control of this process? Oh, this is so good. We're talking about the nurses advocating for a client. Which action by the nurse would require follow-up training? Okay. Which action would require follow-up training, meaning which action is incorrect? Put your answers on the screen. Share this video, guys. This is a specific topic. If you or your friends need to know about advocacy, this is what we talked about tonight. So here in this question, the inappropriate thing that the nurse has done here, is this. It is the number 2, telling the client the best treatment option for them. Telling the client the best treatment option for them. So the nurse is not supposed to do that, guys. You know that. We are not supposed to give, just really quickly, we can do all things, right? Nurses can do many, many things, but for NCLEX, it's never a correct option to say a nurse is giving her personal opinion on something. That's not something that we do. So if a nurse is telling a patient, oh, no, this is the best treatment out, that's a personal opinion, right? Or no, this is the best medication, or this is the best doctor. You guys got to know, we cannot do that. It's not appropriate for us to do that under any circumstances, because what happens? What happens when somebody that you trust, that you think knows better, tells you to do something? It takes it takes the choice away from you. You don't even have any other options, because you're like, well, so-and-so said this, so I better do it because she knows more than me, right? And so that's what happens when nurses give patients their personal opinion. And then, there's nothing sadder than a patient having regrets because they didn't listen to themselves, or they took the advice of somebody else. And so we want to avoid that at all costs. We want to make sure that we are encouraging our patients to look things up for themselves, to research treatments, and do what is best for themselves and their family. All right. So that's a huge point to make sure that you know. Question number 3, I love to see it. The nurse is caring for a client who is having difficulty with verbal communication after a stroke. Which of the following actions by the nurse advocate would require follow-up training? Is it number 1, begin collecting data using documents before receiving healthcare providers' orders? 2, communicating with the interdisciplinary team. 3, waiting for the healthcare provider's orders for speech therapy, then assisting with data collection. Or 4, using documents to communicate information between the client and family. So what we're saying is that the nurse has a patient and he's having difficulty communicating due to a stroke. So which of the following actions by the nurse advocate is incorrect? Which one would require follow-up training? And we have here the choices. Number 1, begin collecting data using documents before receiving healthcare providers' orders. 2, communicating with the interdisciplinary team. 3, waiting for the healthcare provider's orders for speech therapy, then assisting with data collection. 4, using documents to communicate information between client and family. Oh, this is a good one. This is a good one, and it's tricky. That's one thing about NCLEX. Reading, it's so tough. The reading is half the battle. But if you read this correctly, then you know that there is something that is different from the other things. What is it? It is going to be absolutely, I see it. You guys are feeling me on this one. It is number 3. That's not right. And I'm sorry, it's kind of small here, but number 3 says waiting for the healthcare provider's orders for speech therapy, then assisting with data collection. We don't want to wait to do that. If I'm a nurse advocate, I don't want to wait for the healthcare provider's orders for speech therapy, right? I can begin to use tools that will help me and my patient communicate with each other, right? So using the documents, okay, so maybe a patient can't speak, right? They can't verbalize what they need, but could they point to a picture? Could they write something down? I want to communicate with my patient in real time. I want to know, are you in pain? Do you want speech therapy? Is there somebody I should call? What kind of other things are you experiencing? If we wait for the doctor to write orders for speech therapy and then for speech therapy to come in and evaluate our patient, oh my goodness, how many needs of my patient have not been met during this time? So that was the only option that said basically, no, don't communicate with the patient. And just because a patient is having difficulty with their speech, that does not mean that we don't try to communicate with them. So using documents, using resources, using hand signals, whatever we can so that our patient can feel heard, especially if we are talking about nurse advocacy, So that was the topic for today. We are talking about advocacy in nursing, and an advocate is the act or process of supporting someone or something,
But for the majority
and so
of
that is what you guys have to keep in mind when you're answering these types of questions on the NCLEX exam. So I want to get back into the virtual trainer. I just had a few questions that I wanted to address about the VT. So the first question is, where can I get the virtual trainer? How do I get it? And it is super simple. You can get the NCLEX virtual trainer by going to our website. I'm going to put the link in the video. ReMarNurse.com. ReMarNurse.com. I wish I could pull it up, but ReMarNurse.com, and you're able to purchase the virtual trainer. Second question is there a discount on the virtual trainer? Yes, there is. We are using the coupon code No Stress, and that is from our in honor of our anxiety workshop that is coming up. So that is one thing. I'm going to pull it up here for you guys in just a second. So also, what is the virtual trainer? The virtual trainer is a combination of the online lectures that I showed you guys. So you will get the online lectures here inside of the virtual trainer system, plus, so this is part of it. This is where you get all your information. Plus, I'm going to ship you out these 2 books. Okay, so you're going to have your NCLEX virtual trainer workbook, and you're going to get the 5-star quick facts as part of my program. Now, this is the amazing thing. Some of you guys already have quick facts. You already have this book. You got it on Amazon. You got it on eBay. You got it from me. Somebody gave it to you. So all you need is just the virtual trainer workbook, and then the videos online. So if you already have the quick facts book, you can get the rest of the program for a discount. Yes, you're going to get it for even cheaper. So this is the virtual trainer program. Okay, so when I say VT, I'm always talking about these 2 books, and I'm always talking about the online lectures that I showed you guys. All right. Another thing is, how long does it take for the books to arrive? These books literally travel from our office in Ohio to all over the world. So we have these books going to the Philippines. We have these books going to New York, Canada, Florida, right? So depending on where you are will determine how long it takes for your books to come. Mostly the books will get there in 3 to 4 days because we're using the fastest shipping possible. But we also like to send you a tracking number so that you can track your package as well. But don't worry, even if you're waiting for these 2 books to come, you can still immediately get inside the virtual trainer. Immediately, you can get inside the virtual trainer. You can go to your training center. While you're waiting for your books to arrive, you go to this section. It is called Before the Books Arrive. And so even though you're waiting for the books to arrive, I have so much stuff for you to do. And what these are just refresher courses. They are refresher courses. So nursing fundamentals, clinical terms. If you just want to go here one day while you're waiting, you are going to be able to take a 5-question quiz for that time frame, and you're going to read the question, select the right answer. And if you select the right answer, cool, amazing. The virtual trainer will give you a great job. Okay, let's see what we have next. Great. It's a drag and drop. All right. So there are many ways that I am going to challenge you to review the fundamentals. And this is one thing that I love about the virtual trainer is that you are going to be challenged. It is not something that you're just going to be clicking through. These are not boring slides. This is not a boring lecture. Y'all, it's me. And you are going to have to put in the work with the virtual trainer, because if you don't get things right, it's going to tell you that's not okay. It's going to say you cannot pass NCLEX doing it halfway. And so again, this is one of the reasons why I love the virtual trainer, and I'm always talking about it with you guys, because I want you to know that whether you're a registered nurse or a practical nurse, I have a program that is going to help you. Okay. So if you have not gotten the virtual trainer yet, this is the perfect time to get it. We have our coupon code, and I love the name of the coupon code. Shout out to Team ReMar. It's no stress. All right. Learning the content for NCLEX should be no stress involved. Okay. So go ahead and pop that in for a wonderful, amazing discount on the VT. I'm not even telling you how much it is. All right. I'll tell you how much it is. No. Somebody tell them how much this coupon code is to take off for the virtual trainer. It's a good deal. It's a good deal. Other questions I have about the virtual trainer. Typically, students ask me, how long is the program? Again, it comes with a daily study calendar. It is 6 weeks. Now, another thing is I had the virtual trainer and I need to have access to it again, right? Because it's a 3-month program and you stopped access to it, which you can do, totally your choice. But if you're ready to dive back into your virtual trainer, finish the program, go take your NCLEX, and then now is the time to do it. Just go ahead and send a quick email to Team ReMar. My email address is support@remarreview.com, support@remarreview.com, to get back into your virtual trainer. So important for you to do that. So important for you to do that. We are here always trying to make sure that you have everything that you need to pass your NCLEX exam. So I am encouraging you guys. We have a lot of amazing things coming up here in the ReMar community, lots of events, but nothing is more important than you getting your nursing license. And I believe that the NCLEX virtual trainer is going to help you to do that. I believe it's going to help you get better at studying. I believe it's going to challenge you. I believe it's going to give you direction and help you to learn the many, many points of the test plan that you got to know. NCLEX is all about content. It's about content. So the VT is here to help you. It also has questions, but always do the content before the questions, guys. All right. So if you need to send a message to Team ReMar, do that today. If you need to send a message to Team ReMar, if you want to ask them about the virtual trainer, your books, the anxiety workshop, you need to do that right now. This is if you're waiting for a message to do it, this is it. Okay, guys, I'm going to get out of here. Thank you so much for studying advocacy with me. Thank you. Thank you so much. We had a great time for this Winning Wednesday. I shall return. There's much more to do, but we're going to have a good time doing it. Hey, don't forget, tell your friends the test taking anxiety workshop is coming. It's a 2-day event, April 25th and 26th, right here, remarnurse.com/anxiety to sign up for it. And if nobody told you this, I got to tell you, I have to say it. You can, you will, and you must pass NCLEX. You're going to do it. I just know it. I believe in you. All right. See you guys later. Inside the virtual trainer, you will find me. That's the next place I'll be. Bye-bye.